Chapter Implantation of Hair Follicle. Part 2, Implantation using Dull Needle Implanter. The placement of hair grafts into pre-made sites can be done with many different kinds of implanters. I will talk about the use of the traditional Korean implanter with the modified dull needles. DNI, the dull needle implanter technique, has many advantages comparing to the placement with forceps and sharp implanters. I recommend you all to read these two articles in the bibliographic reference. The most important advantages are: first, less traumatic to the graft. When you compare the placement with forceps, there is less chance of trauma to the follicles. Smaller incisions in the recipient sites. Compare the size of 0.85 millimeters incisions with chisel blades and incisions with an 18-gauge needle, used very frequently in pre-made sites to placement with forceps. Third, the placement can be delegated, just like with the placement with forceps, but not with sharp implanters. Incisions are more uniform comparing to the sticking place with sharp implanters. There are some disadvantages, like time consuming to make the pre-made sites, comparing to the sticking place with sharp implanters, and the possibility of having missing sites and piggybacking, comparing again with sharp implanters. DNI technique is the placement of hair grafts with a dull implanter into pre-made sites. All the advantages of this technique can be applied only if you fully understand all the steps necessary to place the grafts. For this, we described the 20 steps necessary for an efficient and fast placement. We divided the 20 steps in 3 different phases. First, prior to the placement, second, the placement itself, and third, the post-placement phase. There are 17 steps in the first phase, 3 steps in the second, and 1 step in the last phase. 5 or 6 magnification of good loops are essential. Our preference is for the LED lights attached to the loops. Ideal conditions of comfort for both the patient and the team are essential for a successful placement. 2 assistants stand on the right, or 1 on the right and 1 on the left. In case there are 2 placers, 4 technicians are necessary, 2 on the right and 2 on the left. Adequate anesthesia and vasoconstriction must be followed by the right size incisions and the right diameter implanters. Methylene blue facilitates the visualization of the sites. The channel is always wide as it allows fast loading and avoid damage to the grafts. The length of the needle must be adjusted accordingly. The implanter must be delivered to the surgeon's hand with the bevel facing to the left, and it is rotated as described in the test. In this way, the hand movement is minimal. A clean field, free of ink or blood, is essential. There are 3 steps in the next phase, the placement phase. The implanter must be inserted in the same direction of the previous incisions. For sagittal or coronal incisions, the implanter should be inserted in different ways. The sequence of placement is important to avoid popping, missing sites, and piggybacking. Finally, the post-placement phase. At the end of placement, check if all grafts were placed correctly and there are no missing sites. If necessary, reposition any graft. In conclusion, the advantages of this technique can be achieved only if you understand and apply all the 20 steps. Now, it's time to practice. Thank you.